us on the program. Let's just quickly talk about the NHIS crisis and the implications it has for the health sector in this country. I'm joined by Dr. Leonard Atsikidi, a medical practitioner. Thank you for coming on the program.
Thank you. It's a pleasure.
Let's just quickly talk about the place of the NHIS in the health sector chain, quickly.
Well, the National Health Insurance Scheme was actually conceived, first of all, in Nigeria in 1962 by Dr. Majekodunmi then, who was the then Minister of Health. And the purpose actually was to allow, provide universal coverage for our citizens. And because government found that most of our citizens were not able to access health care because of out-of-pocket payment cost. And in order to share the burden of health care, they decided to initiate this program, which we call National Health Insurance Scheme. And what National Health Insurance Scheme does is that now people pay, everybody pays. And most of these people that pay, not everybody is sick all the time.
Right.
And now there's a pool of funds that is now distributed among our citizens. And this pool of funds, you discover that sometimes the rich, they have to pay more in order to provide for the poor. So the National Health Insurance Scheme is a very laudable scheme that eventually came to be in Obasanjo's regime.
All right.
So, and presently, it is mainly those who are in public service that are enjoying it. But I think the government has a plan to actually make it universal, so that even our parents in the villages, they can also benefit from the healthcare services.
One would have thought by now our conversation would be about how to make the scheme more popular to spread out the nets, as it were, integrate more Nigerians, and then allow members of the public reap the maximum benefits of the scheme. Instead, we are hearing allegations of fraud on the inside, and how that in itself is taking so much of toll on how effective the system otherwise should be.
Yes, I think this issue has been on now for some time. The issue of allegations of corruption and what have you, particularly against the executive secretary. And I remember at the time the Minister of Health, Professor Adewale, suspended him. Eventually, we learned there was a pro panel that was set up that exonerated him. I also heard that even the two arms of the National Assembly, they also exonerated the same man. But this issue keeps recurring. And I think it's not good enough for our healthcare system. Now, for example, yesterday or so, the workers shut the gate.
Right.
And I don't know what's happening right now. And that shows that the services they render, of course, are actually going to be affected negatively. And in my view, I think it is important that government does something fast in order to resolve the issues. Otherwise, it may have a negative impact on the NHIS scheme itself. So I think we should actually concentrate on trying to expand the coverage so that virtually every citizen in Nigeria benefits from it.
There's a report now making the round that up until recently, the NHIS had been spending about 5 billion naira on a monthly basis amongst the HMOs. That's the health management organizations, and so on and so forth. But under this current administration of President Muhammadu Buhari, that has been cut down from 5 billion to about 1.3 billion. But the government wants the scheme to be even more effective. These HMOs, how critical is their role in this conversation?
No, the HMOs are important in the scheme, in the sense that the various HMOs are the ones who are directly actually, in contact with service providers.
Right.
And they, again, apart from being in contact with service providers, they also ensure that our people get quality healthcare. And they are also they are involved in terms of, collection of the revenue that accrue from the capitation from these beneficiaries, and they remit to NHIS. And I think because NHIS as a body on its own, we cannot cover all the citizens. So actually HMOs are important in the scheme so that, as many of them as you have, they will be able to reach out to people in various places. So they are a critical stakeholder in terms of the of NHIS.
If you look at the world today, health insurance scheme is not peculiar to Nigeria.
Yeah.
I mean, you have it replicated across different countries. In fact, there are 1 or 2 countries who are trying to, in some way, model us after.
Yes, yes.
What are we not doing correctly that's leaving us in these states that we find ourselves in?
Well, like you mentioned, that before the president, they were paying out about 5 billion.
Yeah, on a monthly basis.
On a monthly basis. And now we need to find out why is it that it now came to 1.3 billion.
Perhaps with the same number of HMOs.
With the same number of HMOs.
Right.
That means about 3.7 billion was going somewhere else.
Right.
And these things are not good for any organization. Because now, one issue that people usually complain when it comes to NHIS, patients complain that they don't get the drugs that are prescribed. And now some other persons are pocketing 3.7 billion. Not that is supposed to be spread across so that people can benefit. But now some persons are putting that money into their pocket. That is my own view. Because otherwise, if it is possible to pay 1.3 billion, why have they been paying 5 billion?
Right.
And again, the attitude of our people, everybody want to grab where they did not sow, and it's not good enough for us. And I think that is also impacting on NHIS. Outside that, I thought by now we should have universal coverage. What is the reason why we are not having universal coverage? Why are we still concentrating on just those who are in federal civil service? Most states have not keyed into the NHIS. Why? What is the reason? So I think, in my view, we need to begin to expand NHIS to reach out to every citizen of Nigeria so that we can benefit. For example, if you are NHIS, if you have NHIS, if you only pay 10% of your bill. That means if your bill is $1 million, you pay about 100,000.
Right.
Why should the people who are not even the artisans, the market women,
be part of it?
Be part of it. And I don't think it's a difficulty to do. I think something is happening somewhere that we may not know.
From this whole story, one central point of it is allegation of corruption.
Yeah.
Who is corrupt, who is not corrupt, perhaps we don't know yet. But again, years before now, we've heard about how that there's so much of corruption, massive corruption some persons have alleged within the health sector. If there's anything to go by, is this drama at the NHIS a reflection of that insinuation?
Well, you see, like you said, right now we may not even know who is corrupt and who is not.
Right.
Because what I know of this system where we are in, if I come and I want to change a system for the better, those who have been benefiting illegally from that system will want to work against me. And eventually they will find allegations that are non-existent.
Right.
Now, on the other hand, it may be true that what they are alleging is correct. But we cannot really say who is guilty right now. And I think what government should do is to properly investigate so that we know. And again, you discover that if these allegations are true, of course it will impact on our healthcare delivery system. That means there are going to be some manipulations that are not to the benefit of our people. So I think there is need for government to properly investigate, and whoever is guilty should, of course, pay dearly for it.
Health is critical to an economy, especially when you have an economy that's in a state where ours currently is. We're just going to talk about that for another 5 minutes, but that will be after we take this quick break. Dr. Asikedi will still be here to help us wrap up this all-important conversation on the program this morning. Do stay with us.
TMI, every opinion counts.
Quickly, let's just wrap up the discussion we started a while back. Dr. Asigedi, let's talk about going forward with all of these developments now in front of us at the National Health Insurance Scheme. Is there still hope for this scheme? Is this some bad omen or something?
Of course, there is hope. If I were to say, I think for now, the Executive Secretary actually should allow peace to reign.
Yeah.
In my view, yes, there are allegations, and he thinks they are not correct. But again, in order for peace to reign, I think he should actually give room, you know, to the whatever group that was set up, the panel that was set up, to investigate and eventually...
That even appointed an acting executive secretary.
So he should allow the acting executive secretary to, you know, to act while he goes to take a rest. And of course, if the reports are out and he's not found guilty, I'm sure definitely he will be called back. So in my view, you should allow peace to reign in that organization so that we can begin to move forward instead of spending energy in dissipating energy on things that will not benefit our people. So because, like I said earlier on, NHIS is very critical in terms of provision of healthcare delivery to Nigerians. In
light of what you just said, now, I think we can only be optimistic enough that all of this will clear and then things will return to normal and the scheme itself will improve in terms of scope, efficiency, and everything else in between.
Yes, I'm aware, for example, like Edo State government, they are trying to key in. And if Edo State does that, another state government does the same, of course, we will achieve universal coverage for our people. So
let's look forward to that. I've been talking with a medical practitioner, Dr. Leonard Atigedi. Thank you for coming on the program. We appreciate it.
Thank you, thank you.
Incidentally, that's a full circle on TMI this Wednesday morning. I'll be back here tomorrow, Thursday. Do join me then. I'm Uyi Agmofwegbe. Enjoy the rest of your day.